Hey everyone, welcome to the DSO Study Club webinar series. I'm Bill Newman and thank you for joining us as always. We appreciate it. First time we've actually been able to get all of the emerging groups to watch winners on a webinar. So we're going to discover the secrets behind the 2024 winners. So we're going to give people just a couple of minutes, attendees, to file in. Let me go over the rules of the road here just a little bit. So this will be an hour-long webinar. It is being recorded. So if you know anybody that would be interested in listening or watching this later, it will be on the groupdentistrynow.com website. We'll also have it up on our YouTube channel. The other thing is we had probably 50 or 60 questions come in from you. So thank you very much. We're obviously not going to be able to get to all of those, but we are utilizing those questions to build out a panel discussion, which the emerging groups to watch are going to handle topics like workforce. There's some supplier questions, technology, growth, marketing, some questions like that. But if you didn't ask a question or maybe there's something that comes up, we do have a Q&A area, so you can just type that in. And if we don't get to that, then there might be another opportunity for us to get to those questions during the DSO Leadership Summit in Atlanta. So we'll talk a little bit about that. But first off, welcome everybody to the show. We really appreciate it. I'm just going to go through here really quickly. First off, we have Mark O'Brien from Impression Dental Group. And just so you understand, it is Wednesday morning in Australia, very early morning. So Mark is actually in a time machine. He's ahead quite a bit. So Mark, thanks for making it so early. We appreciate you being here. We also have Jaloy Raymer. She is from Southern Family Dental Partners. She is here as well. We have Dr. Anushka Gaglani from Aereo Dental Group. We have Dr. Corey Hastings from Blue Sage Dental Group and Dr. Mark Darty. He is from Commonwealth Mobile Oral Health Services. Unfortunately, Kelly Kernoble, who was supposed to be here and actually worked on some of the questions with me, she came down with something. Curry Stream was supposed to be here, but I don't see him. So we're going to get things started. Thank you all the panelists for being here. Just go through a couple of things real quickly. If you are interested in finding out more about these emerging groups to watch winners and actually meeting them in person, we're going to do a deeper dive. We have an hour-and-a-half panel discussion live in Atlanta with the winners, September 26th through 28th in Atlanta at the Marriott Marquis. It's going to be a lot of fun. I'll flash this. It's DSOsummit.com. I'll actually flash that URL at the end of this webinar as well. But we have a $200 off code. It's the others that I've seen out there are $100 off. We have $200 off. So just go to DSO Summit, go to GDN and type in GDN 2024 and save $200. So that's going to be a lot of fun. We're going to be doing an hour-and-a-half panel discussion with the winners as well. Just briefly, I'd like to thank Garfield Refining. They are the sponsors of this webinar. Without them, we wouldn't be able to put this together. So shout out to the Refining Authority for DSOs, Garfield. And they've got a quick 20-second video to watch. And then we'll get on with the introductions and Q&A. So here we go.
Garfield Refining is the dental refining authority for DSOs. Whether a top 10 powerhouse or just emerging, Garfield promises results with its white glove revenue-driving program used by more than 75 companies in North America. Visit garfieldrefining.com/DSO to connect with our experienced DSO team and start getting results for your group. Garfield.
I know it always plays again. So, and if you're interested to find out more about Garfield, please reach out to Abby Fuller. She's the Director of Partnerships. Her email address is afuller@garfieldrefining.com. And again, we appreciate them for supporting this. So what I'm going to do now is We are going to drop the screen share. We'll jump back into that towards the end, just with some contact information. But why don't we go through some introductions right now and give everybody a chance really to maybe talk a little bit about your backgrounds and about your group. So I'm going to start with who is at the top left side of my screen. Nobody knows who that is, but it's Dr. Corey Hastings. So Corey, why don't we start with you?
Great. Thanks, Bill. I'm Corey Hastings. I'm a pediatric dentist by training, co-founder and managing partner at Blue Sage Management Group out of St. Louis, Missouri. We started in 2019 with 1 practice and 0 patients. We have 6 affiliated practices now and over 20,000 active patients, and just very happy to be here.
Thanks, Corey. Dr. Mark Daugherty.
Thanks, Phil. Thanks for having me. So Mark Daugherty, been in practice now for close to 20 years. I wear a few different hats in the dental field, both in the private practice sector and the public health sector. So I am an endodontist, root canal specialist, have 4 locations in Massachusetts, have 2 business partners and 2 associates. We all kind of travel to our different locations each day, providing endodontic services to our patients. Separate from that, I have a dental consulting business where we do consulting for a wide array of different dental environments, anywhere from private practice, DSO, to dental practices of federally qualified health centers, community health centers, dental schools. And lastly, and more specific to today, I have a large portable dental practice in Massachusetts where we have dental teams that go to about 350 different schools and locations throughout the state, providing comprehensive dental services to underserved populations, mostly to children who have Medicaid and don't have a dental home. And when I say portable dental care, is different than mobile. Mobile is really vans and buses. With portable dental care, our dentists and hygienists go to schools. They have all of their equipment with them in their vehicles. They'll set it up at a nurse's office at a school, treat the patients for a day, a week, whatever, however long it takes, pack up all their equipment, and then head to another school to provide care. So thank you.
Thanks, Mark. And the other Mark O'Brien from Impression Dental Group.
Good morning, Bill and viewers, and thanks for having me. So my name is Mark O'Brien. I'm the CEO of Impression Dental Group. We formed officially in 2021, and since that time, we've grown the network from the foundation of the business, which was a business that was acquired out of administration. So it was a fairly distressed business. We took that as the seed for our business, proved out our operational model, and have tripled the business since that time with over 20 locations, from as far north Queensland down to Victoria. We are pure play aggregators, and my background has been mostly in aggregations of businesses, whether that's allied healthcare, childcare, the veterinary industry, and also had a short stint in big pharma as well. And it's an absolute pleasure to be here and to talk to you, Bill, and to the rest of the panel.
Thanks, Mark. We have Dr. Anushka Gaglani from Aereo Dental Group. How you doing, Anushka? It's good to see you.
Good, great to see you as well. It's a pleasure to be here, and thank you for the honor. We started at the end of 2015. It was basically the beginning of 2016. My husband and I, we are both business and life partners, Dr. Abhishek Nagaraj, and we associated for a couple of years. We decided we wanted to have our own practice, and then we got tired of seeing each other every single day. So we got a second practice, and we added one every year except for during 2020. Can't remember why, but something about a virus. In any case, since then, we're at 7 now. We've done all the models. We've done de novo, we've done acquisition where we didn't keep the dentist, and then we've done affiliation. And we're going to continue to grow our vision. We're going to get to 200 practices in the next 10 years.
Excellent. Thank you, Anushka.
Joy
Raymer, she is with Southern Family Dental Partners. Joy, thanks for being here today. You were on the road, right? Well, you still kind of are, right?
Kind of. So thank you so much. Really excited to be here today. Joined the company in 2022. when it was newly formed from the founding dentist as CEO. We started with the affiliation with the founding dentist of 4 practices. We are now currently at 17 locations in that time period, with the expectation right now to be on target to be at 25 practices by the end of the year, given our current pipeline. We are primarily in the Southeast. That is where we plan to stay. The strategy that we employ is very much kind of like looking at SEC markets instead of NFL markets. So we are looking to serve that more mid-range community where we think that there is a need for dentists. My background is primarily healthcare, started in nonprofit hospital, moved to academic for a short period of time, and really loved the for-profit model, starting in a consolidation in anesthesia, and then moved to dermatology where we grew to over, excuse me, where we grew from a starting at 15 practices to about 115. So that's about what we're looking to be. We're not looking to be another big box DSO, very boutique oriented and just in the Southeast.
Great, thank you. Well, let's get started with the questions that came in from the registrants. And like I mentioned before, if you do happen to have a question, you can type that in the Q&A section, and we'll be monitoring that. Can't guarantee we'll get to everything, but we will try. And like I said, if we don't, then you can come to Atlanta and ask those questions live. It'll be here before you know it. I think we're about a month out right now. So we're looking forward to that. So the first topic is workforce related. So we're looking at recruitment and retention, and it looks like Mark Daugherty wants to take the lead on this. So the question came in and it was phrased this way: the post-pandemic workforce challenge, which really might have started pre-pandemic in a lot of cases. But anyway, we still have workforce challenges. What's the one thing that practices need to do, or maybe that you're doing at your group, to set themselves apart to attract talent? So this one's really about attracting talent. So Mark, why don't you, Mark Daugherty, why don't you start off?
Thanks, Bill. And yeah, really great question here. A lot of great questions. So for me personally, I usually like to tend to follow the data. I follow the surveys, the research, the studies, and I look for it to tell a story. And the story that it's told over the past several years is that one of the top reasons why hygienists are leaving our practices and dental assistants and dentists is because of poor practice culture. So, it's really incumbent upon us to, really establish, and I feel build that positive, optimistic, upbeat culture, upbeat environment. And, we know that the dental world is pretty small, and, certainly word travels fast. People talk a lot. And, we tend to hear which dental practices, especially in our areas, in our regions, have that positive and upbeat environment, and which ones, might need some work on that and to build on that. But certainly, in hiring and retaining those quality employees, I tend to really focus on and, really I'm a big advocate of having that positive culture.
Who'd like to go next? How about you, Corey?
Yeah, I have to agree. Culture's king for us. We're working with kids in particular, and specifically, you see I'm wearing tie-dye today, tie-dye Tuesday. It doesn't apply in Australia at the moment. But creating a fun environment. The reality is we spend a lot of time at work, and you don't want somebody walking in for a job interview and seeing your front office team stressed, right? And so like Mark said, news travels fast. Another thing that we focus on in particular is our mission is developing people and creating pathways of upward mobility that you can't get in a traditional dental setting. And so we focus a lot on training protocols and creating ways that, may not be found again in those traditional dental settings.
Thanks, Corey. How about you, Anushka?
I think everyone's already kind of said it, but I would definitely agree with culture. I think money is important, so are benefits, but the right people for the organization won't leave if they fit well within the culture you've set. Growth opportunities, and I think for dentists in particular, I think I hear a lot of I want mentorship. I think it's offering true mentorship, and that means spending time with them, actually teaching them, holding their hand as they're doing procedures, as well as possible partnership opportunities if they're the right fit.
Julia, I don't know if you have anything to add to that.
So one thing I would say that we have also leveraged in our areas is flexibility of schedules, because we are looking to have a clinic that potentially is running 5 or 6 days a week. We have some flexibility on schedules, and that has really proven to be a great opportunity for people who might leave for other reasons. Definitely agree with culture 100% as a priority, but that is a differentiating factor for us, is if you're able to be creative with the way that you schedule your team and hear what they actually need to balance their life, and you can balance that with other people that you're hiring, it really is an effective long-term retention tool.
That's a great point. And Mark O'Brien, I know that things might be a little bit different in Australia because some of these additional questions under the workforce topic really don't necessarily apply to you. Like you mentioned, hey, we don't have a hygienist shortage here in Australia, and I'm sure there's probably some people on the call that are probably a little jealous about that. But
Yeah.
Tell us a little bit about what the workforce landscape looks like in Australia.
I think, and as I've got to network and learn more about global groups, I think some of the challenges that I have down here are the same as the challenges that you have in the US, and some of the challenges that our European counterparts have as well. There absolutely was a talent shortage post-COVID, but I feel like the pendulum has swung from a clinician perspective. And certainly in Australia, there's a pathway to practitioners coming from overseas called the ADC program. Those candidates would typically enter the country in auxiliary roles. So they come in as dental assistants. And that shut off during COVID. So there was a real issue with support staff in Australia. So at one point in time, it was much easier to get clinicians than it was to get dental assistants. So many organizations had to pivot really quickly and take almost unqualified candidates and take them through bespoke or individual training programs, which had some benefits because you're teaching and training those individuals from scratch from day one. So they don't bring any, whilst they don't bring experience, they don't bring any bad habits with them as well. At the moment, as you said, we don't necessarily have an issue with hygienists. We have several dental schools now that are offering additional hygiene programs. And there's 2 streams, one which has an adult scope stream, which takes pressure off preventative dentistry for some of our clinicians. And then there's pure hygiene, which is supporting dentists in those preventative measures and looking after kids, children as well. But just to, if I may add to the previous question as well, I think as an organisation, it's really key that you've got a set of core values that you're anchored by, and you are able to articulate those to clinicians or anybody that you're trying to attract to work with you. And that really sets the tone of what culture looks like. And underpinning that, obviously, is the things that we can do to value add to practitioners. And that's why I'm really pleased that we have over 90% retention of our practitioners, is because we truly, value add to their experience. Like Anushka said, there's true mentoring that happens in practice. There's a bespoke education program that we went out and asked our clinicians, what do you want to learn about? And then delivered it. And then finally, is just having an element of operational excellence. And that's as simple as having the right equipment, the right consumables, the right DAs, the right support, the right reception that can rebook those patients. And I often say to my team that, and this is a little bit of a flippant statement, but dentistry is really simple. To keep a dentist happy, you just make sure that they've got patients to look after. So I often say that the 2 most important people in our organisation are the recruitment team and the marketing team, and the rest is obviously periphery. That's obviously very simplistic, but you know, if I was to kind of put my finger on one thing that keeps our clinicians happy, is making sure they've got busy diaries and busy books.
Oh, great points. Anushka and Jaloy, hygienists. Let's discuss that, because that is an issue for a lot of practices out there. Any strategies around that, and also just the wages for hygienists have really become pretty high. So how have you addressed that? What's and has there been any thoughts around increasing production, or to discuss that? And maybe you're not having any issues, but good, Anushka.
Okay. So I would say yes, absolutely. Hygiene is a challenge across the board, I think. I think because they get so many opportunities, and they are actually willing to go for not, definitely culture is important, but when you get a new hygienist in, who's not really experienced with your location, we have had some turnover that has existed because people are willing to, we've got a dentist who just has no hygiene and is not really maybe completely business disciplined, and is willing to have their hygienist as a loss leader, which I think is a very bad thing for our industry and bad for just for their business model. So that has been a challenge. Absolutely. I think from a retention standpoint, training, actually working with the hygienist on how to create their schedule, not just for them to be successful. We have a combination of commission and hourly models. We give some structure to those, and the hygienist can choose. And that has been very successful because they're not, I wouldn't say they're equal in our mind, but they're close. And I think it really depends on what is valued by the hygienist. So offering them, treating them like an actual provider and somebody who's a vital part of the production team, I think is important. And they've got some choice in our company where they can kind of look at those different models. And I think another thing that they really want is the opportunity to mentor and work with other hygienists. Not all of them, but we've had some good success with creating like almost like an advisory board or a clinical committee throughout all of our practices with all of our hygienists. And that has really improved the culture, not only of their practice, but really of the overall organization about how we support our hygienists. So I think it's a combination of culture, compensation, and that they like what they're doing and they feel like they have an opportunity to learn.
Yeah, I completely agree with treating the hygienists as providers. In fact, we see it same page with us. We hire people, going back to, I think Corey had mentioned, or somebody had mentioned core values. We hire people who want to grow and learn. So one of the things we've heard from our hygienists is they really, really like the fact that we provide continuing education within our group. We have group events. We're partners with Zimby, Patterson, et cetera, and they are able to provide these continuing education events for us. So we have been actually able to get hygienists within our network, and our own hygienists are referring other hygienists to us. So we've been lucky in that aspect. There has been a market increase in comp. I know, back when we started, I think we were paying high 30s, low 40s, and now it's low 40s, maybe low to mid 50s. And I know that's still lower than some areas in the country. We do have an incentive plan tied to production, and we train on additional services like laser assisted periodontal therapy, right? That kind of helps offset some of the production. So doing just a pro fee for us is not going to do anything. Our hygienists have to be those providers who are actually providing high level service to our patients. We also allow a certain amount of time for patients, going back to culture, trying to get our hygienists to, squeeze more patients in. That's not really our method. We're going to give them the appropriate amount of time that they need. What we may do is assisted hygiene. That is a model that we've utilized that's worked very, very well for some of our hygienists. And, overall, again, because they're providers, we look at them as an overall revenue producing provider within the company, which is not just them producing the hygiene, it's also assessing and suggesting for our doctors. So they're working as a team.
You made a really great point about the continuing education side of things. And I'm going to pivot here. I'm going to have these questions relatively organized, but I just went right to one that was kind of at the end of the the questions, but I think it really ties into what we're talking about, from as a recruitment tool, culture. You talked about things like that. Education seems to be so key. So there was a question that came in, which was, it was pretty general, but it discussed how do you accomplish team training and development within your organization? And if you do that, which I assume everybody does to some degree, do you do it virtually? Do you have, regional or practice level education live? So I know it's kind of a general question, but it really does tie into what you just mentioned, Anushka, the importance of whether it's continuing education, whether it ties into culture. Maybe we could talk a little bit about how you handle education. Corey, maybe we could start with you and how you look at educating your clinicians, and it doesn't even have to be clinicians. It could be your office staff as well.
Yeah, so I'll start with clinicians. We have a core set of courses that we recommend that clinicians look. Now, that's up to them to do that. We have a mentorship program. If a clinician has a desire to learn, whether it's related to dentistry, related to business and practice efficiencies, we tie them to a mentor that can coach them through that. At the practice level, we do a lot of virtual training for all of our locations. And then we do quarterly what's called leadership training, and we focus on a topic. Right now, we're doing a lot of internal customer service. So not only making our patients satisfied, but making the team members as well, and treating your support system as patients essentially. And so we do, to answer your question, yes, we do a combination, virtual, in-person, and we provide a mentorship program. And we have a tiered training level. It goes back to that retention. We talked about that before, where there's different levels. We can have somebody with zero dental experience come in and provide assistant care and be pretty proficient over 6 weeks through an intense and intentional program. And so to answer your question, yes, we do all of the above, and we do it at the practice, regional, and entire company level. So.
That's great. Anyone else want to kind of give us their secret to success when it comes to education and training? How about Mark Daugherty?
Yeah, so, with portable dentistry, certainly a different delivery model of care. And as Corey mentioned, we do similar things, virtual. We'll have an all day where we bring in people to speak to our dentists, to our hygienists, to inform them better. But what I also like to do is I like to have our veteran dentists go with some of our newer dentists on site. Now, I'll pay our veteran dentists to go on site with the newer dentists, to shadow them, to assist them, to help them through the whole process, because school-based dental care is certainly, it's a different model, and it takes a while to adapt to that. But, our younger dentists love to have, the more veteran, more experienced dentists with them there to help coach them through on how to, how the workflow goes, how the operations go, and so on. So, yeah.
Anyone else? And I'd love to, does the mentorship side of things seems really important? Do you see that as something well, Mark, you're shaking your head, Mark O'Brien.
So I echo everything that Corey and Mark have talked through as well. At Impression Dental Group, we're really lucky. One of the companies that we acquired actually owns a dental media business called Articulate Media. So we've been able to stand up a fairly bespoke education program for our clinicians that's delivered in really high quality. And our philosophy is to go out to the industry, whether that's local or global, to get the best talent to deliver CE to our clinicians. At the moment, that's delivered purely online. Through webinars, and it's available for clinicians. So it's obviously live, but it's also available for clinicians to watch at their leisure. We also offer shadowing, so it was great to hear that Mark also does that with his clinicians, and particularly in those higher value categories like aesthetics and surgical and implantology, where individuals like to get that confidence in their clinical competence around those, and we've got some of the best in the business to be able to do that. We also help support pay for our clinicians to do CE. We don't force them to just do the Impression Dental Group education program. So if there's something that's bespoke or something that's unique that they want support with, we'll obviously support the clinical time as well as the financial part of it as well. We're just about to launch a series of mini symposias where we bring, and you know, this is one of the benefits of starting to get scale, is where you bring the clinicians together face to face to network and deliver training, you know, clinical training and or leadership training as well. So that's from a clinician perspective. We're actually right in the middle of our practice managers or office managers conference at the moment. This is our 3rd year that we've done it. We started with 12 people in year 1. You know, we had 65 people in the room this week. We fly all the practice leaders in from each of the practices and deliver them 2 days worth of leadership training, as well as, you know, clinical training around infection control and work health and safety and workplace relations and all those sorts of things. And then finally, I think, you know, underpinning that, you need a really robust induction program, not just for your clinicians, but for your auxiliary and support team. And we deliver that through a learning management system and LMS called Employment Hero, as well as the product that we've got as well. So it's something that is really quite unique to IDG. I mean, education isn't, but the way that we deliver it and the way that we engage with our clinicians has really set us apart in the marketplace. And it was one of those things, as a young company, it was difficult to make that investment because you're obviously managing your cash flows really carefully. But it was fundamental to the DNA of our organization. So we stood it up and invested ahead of the curve to make sure that we could deliver it.
Juloy, do you have anything you like to say wrapped around education, or whether it's virtual, or what do you do at Southern?
So the other thing is we utilize our technology because we are all over the Southeast. We try to really utilize our technology through Teams and through some other like chatting apps where we've got hygienist only chats. They can share cases. It's all HIPAA compliant. They can share cases. They can ask questions. It's real time. They can get access to their people, which is not official education, but I think it is actually, it speaks to culture. It speaks to being able to work together. But it also really gives the benefit of those really seasoned hygienists to the new hygienists and some of the newer hygienists who have maybe a little bit more experience with some newer technology to educate and to work with the more experienced hygienists. It's been really fun to watch grow.
Thanks, July. And Anushka, anything you want to add?
You know, I love what everybody said. We kind of do a combination of some of those things. A couple things we also do is mentorship. Everyone that comes into the company is assigned a mentor when they first start. So, you know, the dentist is an example right now, because Dr. Raj and I are still clinical 1 to 2 days a week. We take on every new doctor within the practice and they shadow us for a month and they learn how we talk to people and they learn how we do procedures. Our hygienists, you know, they follow our top hygienist. The second thing we do is we run on EOS, the entrepreneur operating model. So I'm sorry. So we have L10s every week and every single role is on an L10. So there's continuous training with that.
So I've got, if you've seen me, I've been texting ferociously. Kerry Strain's been trying to get in and is having technical issues. So we're going to try this here. He has come in through an attendee and he raised his hand, although it says Stephanie, but it's Kerry. At least that's what Stephanie is telling me it is, but I think I can actually allow this person to talk. The hand was up for a second and now it's gone. So raise the hand again. And I think I can actually let you talk here, but, oh wait, here we go. All right, let's just try this. This will be fun. All right, doing it live here. If it doesn't work out, you can blame me. Now, Kerry, is this you? You got it?
Hello, Bill. It's Kerry.
Okay. Well, there you go. Even though it says Stephanie, we'll believe you. So Kerry Strain is with Strain Dental Management. He's had trouble getting in. So, all right, you're in now, and I might even be able to change your name while while you're speaking, but how about an introduction for the people that might not know you since you missed that part?
Number one, I'm very impressed with the group I'm listening into today, and it's an honor to be on the call with you. Sorry about the technical difficulties all the way here from California. But, I've been in the dental industry over 30 years. After a career in public accounting in the early 90s, my wife and I launched a consulting firm that worked with over 6,000 practices, private equity backed, lender backed, et cetera, as well as individual practices. There were so many of them. But at 16, we began a journey towards building our own DSO. We brought our clients, a group of them, under a management services agreement in 18. And we funded the initial acquisition of 33 practices in 22 with a loan from our lender. And since then, we've grown to 45, and we anticipate robust growth over the next 2 years. So our relationships have been with many of our practices for over 10, 15, 20 years with the operating policies and the management systems in place, and listening to how y'all communicate, whether it's, I love the mentorship program, Doctor, that you were just mentioning, and I think that's fantastic. I love what the gentleman, I don't know what country you're from, Mark, but I love your accent. And yours too, Jaloy, it was fantastic. And we use an education platform based around the work we've done as a consulting firm for so many years, and bringing everybody into alignment from an operating policy and management system standpoint, leaving the clinical decisions up to our doctors who've grown great practices and continue to move forward in that path. So I'll catch up with you, Bill, but I did get the chance to listen to the last three presenters.
Excellent. All right. Well, we can keep you on and we can ask you questions now that we know it really is you, Kerry.
Thanks, Bill.
All right. Awesome. Great. That works. And we know that we can actually bring people in if they're having trouble as an attendee. Okay. So we're, as we kind of move through things, and we've got so many questions. This is why everybody has to come to the DSO Leadership Summit, because we've gone through like 2.5 questions here. So I'm going to ask a supplier question, and then I've got some questions wrapped around technology. Everybody always wants to find out kind of what everybody's doing technology wise and how they're leveraging that for their groups. But on the supplier side, because we do have a lot of vendors that are on this webinar and really interested in finding out a little bit more about how to work with you all, let's talk about the procurement process and how that fits into your growth goals, and then kind of built into that are preferred ways you like to engage with suppliers. So it's like 2 questions. Talk about the importance of procurement, maybe a little bit about what that process looks like, and then what's the best way for vendors to work with you. So kind of 2 questions there. Let's start with Corey.
Oh, great question. So I've really taken my hands off of a lot of the procurement activity in our organization, and I've delegated that to somebody who looks at pricing and all that. So the best way to engage with us would be to reach out. We have a Sarah in every part of our organization, and so, but we're not looking for transactional relationships. We're actually looking for relationships, and so we don't want vendors that are here just for the sale. We want vendors that we can be with and grow with and benefit one another. So,
thanks, Corey. Anybody else want to tackle that? How about you? Let's go with you, Deloitte.
So I would say, agreed. I definitely agree with Corey. I want a partnership. I don't want to be looking to change vendors every year because of some small reason, like cost. And cost is not a small reason, because it can be significant, but that's not going to be my driving factor. I really like vendors who bring cost savings to me or ways to do business better with me proactively. It makes me look less at potentially needing to look at price changes. And then I think the other big component is that they are really proactively, like they function as an extension of us instead of a vendor. And I think that just goes to what Corey was saying about being a partner. So like our IT vendor, because we don't insource that is completely outsourced. I'm not sure you would know that if you worked with our company, because they are so well integrated with us. So been very happy with that. So that's what I'm really looking for, is that it feels very similar, that even if their culture is different, that they know how to to collaborate with our team in a way that fits in with culture. So it really extends our ability as an organization to feel bigger than we even are because they work well with us.
Nushka, maybe I'll build on this a little bit. Do you have a formulary that you use at Area?
We do have a formulary, and this is actually procurement's a big passion of mine. So thanks for asking me that. You know, being a dentist, I think it's very important to me to have a formulary. I know we've had dentists come in that say, I want XYZ composite. I'm like, that's great. If you can produce X amount, I may consider it. Until then, we're using this that's on the formulary. Because, you know, being a practitioner myself, I know that's a great quality composite. One of the things that we looked for too was, you know, a vendor who would work with us on unit level pricing, because we had vendors before who would say, well, if you do bulk, I'll give you free goods. And that just wasn't going to work for us. So the way that we shaped our formulary was around vendors. For example, Kerr, they worked with us on unit level pricing, so we can just order monthly and not have a bunch of expired product.
Great. How about you, Mark? Formulary, and how do you tend to work with?
No formulary, but you know, it's funny because usually, you know, when we're scaling, we're growing, we want that equipment yesterday, right? We want the supplies and equipment and materials. We wanted it yesterday, not a month from now. And we can be, you know, pretty impatient with that. But, you know, for me personally, I really like it when, you know, that relationship, that meeting is organic, that there's trust there. That it's a friendship, right? Because, you know, we're working with people in a partnership, and we're letting them to our businesses that, you know, is our passion, is our life. And, you know, as a practitioner, you know, I look at it as, okay, well, with my patients, you know, I'm always engaged, I'm always available, I'm always responsive. And I look for that, you know, with vendors, with partners that I work with also. So, you know, things that are very important to me.
And Mark O'Brien, how do you what does it look like? Do you have a formulary at Impression Dental Group, and how do you work with your vendor partners?
Yeah, so we don't have a specific formulary, and like Anushka said, procurement is one of my passions. I've come from the supplier side, so I understand the pressures that come from the supplier side, but also what good looks like in terms of value adding. A big part of our value proposition, and this will be a challenge as we continue to scale, is clinical autonomy. So it does mean in some cases we have multiple products for the same thing in our practices. But what we're trying to steer towards is preferred partnership agreements with our key suppliers, where we then have a good, better, best range. Just to try and limit, you know, having 6 different types of composites sitting in a drawer in a room. So we actively engage with each of our suppliers, our key suppliers. If you look at our business, 70% of our procurement comes from 3 or 4 key suppliers, and then there's a very long tail that obviously is important, but also adds operational complexity, more so from a back end. So we've centralized, not so much centralized procurement, we still give that autonomy to the practices. They have a budget that they work against every month. But we have a procurement platform, which is a white labeled product called Cooper. And that's actually just been adopted by Bupa Dental over here. And that allows us to make sure that we're getting the right pricing, passing that pricing through to the practices so that their P&Ls are accurate, and they're seeing the benefits of the scale benefits that we get in terms of the unit pricing as well. But I'd say one of the most important things from a supplier perspective is, like everyone said, is that value add. You know, pricing is clearly important to all of us. But I also want to know that when there's an education event, or when there's you know, some other support that I need, I can go to my key suppliers and they're there to support us as well. And not just clinically. I mean, one of our key suppliers is working with us around an ESG initiative where we're hoping to look at the carbon footprint of our deliveries. And Australia is a big country, so if we can move our purchasing from 4 times a month to 2 times a month, the impact of the carbon footprint will be significant. So that's just one of the kind of left of field but value add things that we're looking at as an organization.
Great. Thank you, Mark O'Brien. Carrie, how about you? Any feedback on formulary? How would you like vendors to work with you and Strain?
Yeah, we have a biz ops department, so they would reach out to our biz ops department at Strain. Let us know what their offering is. We do a weekly review of new innovations that come our way, but we also use a third-party advisor for procurement management. They've been in the dental industry many years. I've known Joe Cavaretta since 1997. So we use that team at the Cavaretta Consulting Group to help us develop our strategy, negotiate contracts, and then build in our ordering platform online so that the various accounts that the practice have to buy the product can be accessed. And while getting the product each provider wants and making sure it's always available, we always want to be cognizant of the overhead costs and managing our overhead. So many strategies similar to everybody here, but it's combining the interest of the clinical care and making sure that we're always prepared for access to care, coupled with good fiduciary responsibility from an economic standpoint.
Great. Thank you, Carrie. Let's move on to technology. And this is always, I think, one of the most interesting things to talk about, because it seems like in dentistry, I mean, everywhere, but certainly in dentistry, it's rapidly evolving, and you try and stay ahead of it. And it seems to change weekly. So Dr. Hastings, maybe talk a little about some of the technologies that you're using at your group that have been helpful, and maybe some technologies that you're not using yet that you might be interested in the future.
Yeah, good question. So we're not early adopters in our organization, but I say that, and we really dove into the platform that Dr. Brian Laskin has rolled out, Tooth Apps, to kind of integrate all of our softwares into one central location. And it's also helped driving our analytics. But the bigger piece of that is efficiency and communication amongst practices, not only internally as our own, but laterally for another referring provider. And so we're really excited about that communication piece and flow of information so that we can better care for our patients. But as far as within our practices, I mean, we're not adopting innovative technology or what would be considered innovative technology.
Okay, so Tooth Apps.
Tooth Apps, you got it.
Great. Okay, Mark Daugherty.
So actually, I'm another Tooth Apps guy, and so we're using it within my practices, and it's just a great form of communication. It's great to know that we're being HIPAA compliant, and that all of our staff members can communicate and get messaging out there, and we can break off into other little sections to discuss certain topics. But another big thing with my portable dental practice is the EDR that we're using, and we've gone through a few different EDRs over the years. But one of the biggest components for us is our ability to do reporting for the schools that we work with, for the state of Massachusetts, Department of Youth Services, Department of Social Services. And until more recently, with going with a new vendor, we haven't had that ability to share that reporting, what we're doing for services on the patients, what we've achieved, what we've done, how many patients we've seen, and so on. But that has been, very good for our practice to have that ability, again, to report on what we're doing and sharing that information with our partners that trust us, and giving them more information on what exactly we do.
Thanks, Mark. How about you, Jaloy? Technologies?
So we're all on a single platform. We do that at acquisition within 60, 90 days. So that really does drive our analytics to be able to offer transparent information to all of our providers. They really like that. They like that they can run their own reports. We're not hiding anything. It's all available to them. So that is really helpful. We deploy scanners right away. Most of our practices do not have those when they come on board with us. We train them how to use them and what they can do with them. And I think the other thing is because we have a clinical advisory board that we meet monthly, we also bring all new technology. Like anybody can bring like new implant types. They can bring any technology that they're interested in pursuing. We looked, for example, we did some trial of some AI software in diagnosing, and then everybody comes and gives feedback. So the benefit there is that we're able to partner with companies who are willing to let us trial new technology, and then we give feedback, and we also sometimes use it, sometimes we don't, sometimes we deploy it, and sometimes we don't. But what I think is the overall benefit is that all of our dentists have the opportunity to play with the new toys. They get the opportunity to give feedback and to see what is interesting to them, and what they can do. And then we're also able to explain the business model and in a way of just saying, hey, cost, and this is what we'd have to produce and what makes sense. So it really allows us to have great conversations in what they're utilizing and what they're interested in learning and utilizing, instead of us from a corporate level coming in and saying, hey, we're deploying this new technology. They have a lot of input and feedback on what we do deploy.
Thanks, Julie. Anushka.
Yeah, I think a couple of things for us. Moving to cloud-based software, we were server-based, and that was really a pain with 7 practices. So that's really helped kind of minimize having to transfer over information for patients. We just recommitted to Patient Prism, very excited with what they're doing. We were also using NVIDIA. Speaking of diagnostics, we're looking for other alternative options now, but that's really, really helped. As far as new, and also Jarvis is another thing we use on the back end. New technology solutions, I'm most excited about anything that can relieve dependence on people and remove opinions. So whether that's an AI receptionist, someone doing breakdowns, et cetera. And again, big fan of diagnostics, because that way, we're data-based, we're fact-based, and it's not, well, maybe this is a failing, maybe it's not, but it's literally in front of you that this is a cavity. So that's those are the things we're really aiming towards solving for ourselves.
Great. Mark O'Brien.
Yeah, look, I think we've adopted technology fairly well across the organisation, and again, it's one of those cost benefit things that you have to weigh up as a scaling group, and deploy capital where it's obviously going to drive additional commercial outcomes, but also better patient or better clinician outcomes. So clinically, I mean, like many of the panelists, we have digital scanners across the practices, and we've adopted the digital revolution that's happening or happened in dentistry. From a support office perspective, we're a dental partner organisation, so have partners in our practices. So it was really important that we were able to build out a platform that allowed detailed analytics for that transparency, just again, Anushka said, and a really robust reporting pack for our dental partners. We've adopted technologies to protect against cyber attacks as well. That's obviously something that's important, not just in every business, but particularly in healthcare, where patient records are particularly valuable for scammers and potentially reputationally very damaging as well. So we've overinvested in making sure that we've got systems in place and training in place to protect us against those cyber attacks. And then from a patient perspective, we've adopted a platform called Customer Radar, which measures the patient satisfaction after every single visit. So as soon as somebody checks out of their appointment, within 10 minutes, they have a text message to say, how did we do? And give us a rating between 0 and 10. And then they're able to write some commentary, and that gives us some really deep insights into what's going really well in the practices. It's a coaching tool, but it also picks up any potential problem areas early as well. So that's something that we adopted really early as well.
Great, thanks, Mark. We've got about 4 minutes left. So Carrie, if you want to tell us briefly about the technology that you're using at Strain, and then I want to make sure that everybody has an opportunity to just give us a little peek into what the rest of 2024 looks like for your group. And then we'll also make sure everybody knows again how to get a chance to meet everybody in person in Atlanta in the next month. But Kerry, talk a little bit about strain and technology you might be using.
Yeah, Bill, from the practice management software, we're not on the cloud. We are going through the final analysis of moving to a cloud-based system. Certainly for those practices that are using Dr. Laskin, I applaud you. I've known Brian for many years. He was a client of my consulting firm when he was in practice, and I've done some podcasts for him. So anyway, a lot of what you said, we're in sync with it, from artificial intelligence to patient communication. Anything we can do to help, again, the patient's experience and access to care.
Thank you, Kerry. So again, we'll just, so we got a couple minutes left here, but I want to make sure everybody gets a chance to just let us know what does the end of 2024, beginning of 2025 look like for your group? And we'll start with you. Well, did I miss Corey here? No, he's still here. There you are, Corey. We'll start with you, Corey.
Yeah, thanks again, Bill, for having me. So 2024, I'm excited to see everybody at Atlanta that'll be there. But 2024 for us, we're rolling out, or we're adopting a couple new critical core values, because culture, we talked about that, and then adjusting and modifying our owner-doctor structure. So that's what we're looking for at the end of 2024.
Thank you, Corey. Jaloy.
So we have launched a associate partnership program for our dentists. Excited to get that going. Our dentists are excited about that. So they have an opportunity for a partnership type track. Additionally, we are just in acquisition mode. So like I said, we are expecting to add 8 to 10 more practices by year end. So we are pretty much focused on that full time.
It sounds like a full-time job for sure. Kerry, strain dental management.
Yeah, for the rest of the year, Bill, we're expecting to add approximately 30 to 35 practices between now and the end of the year. Our offering, as you know, provides for a lot of equity participation for doctors that want roll-in equity, in that we're lender-backed instead of private equity-backed, and seeing all the equity our platforms have brought to their equity partners, we want to make sure we brought it to the doctors. In addition, we've rolled out our employee incentive plan, so doctors can incentivize their associates and virtually every team member with an opportunity to own stock through their holdco in the SDM platform. So a lot of exciting things to come, and a busy 2025 ahead.
Great. Thank you, Kerry. Anushka, what's the 2024, early 25 look like for Aerial?
I think for us, we're really, really heavily focused on same-store growth. We are going to continue to optimize our practices, increase hours, continue to improve benefits, and of course, be opportunistic. If the right opportunity comes along, right affiliation, something we're definitely open to.
Great. Thank you, Anushka. Mark O'Brien.
Yeah, thank you, Bill, for having me. It's been great to chat and meet the rest of the panelists, and I can't wait to see you all in Atlanta in a month's time. But like Anushka, our business is really focused on driving like-for-like growth in our centres. Because we're M&A driven, we've got a reasonably deep pipeline, and expect to settle a number of transactions between now and the end of the year, so that everyone who's doing integration understand that's all hands on deck. We've got a number of clinical symposia which I mentioned earlier, that we'll start rolling out. We've got 3 additional education programs that we're rolling out. Our graduate program has just stood up as well. So in Australia, graduates finish in December, around November, December. So we'll be onboarding a number of new graduates into our network through engagements with universities. And we've also just recently stood up an international recruitment strategy. So we've got 4 dentists coming across from the UK and Scotland, and we'll be making sure that they're embedded into the Impression Dental group and welcomed with open arms. So it's going to be a busy end of the year.
Excellent. And Mark Darty.
So, in Massachusetts with our portable dental practice, with the pandemic, schools were closed for like 2 years. So we lost a fair amount of our dental providers. So since then, we've been in a rebuilding phase, which has been going well. But, interestingly enough, we've also gone from a model of care of more prevention-based care. And, the use of silver diaminine fluoride, SDF, has really been a game changer in our model of care.
Great. Thank you, everybody. And just one last note, if you want to see and get a chance to meet them in person, everybody here and some more of their team, so not just the panelists, but and also Kelly, who wasn't able to make this webinar, you can go to dsosummit.com. It is the September 26th through the 28th in Atlanta. Use code GDN 2024 to save $200. Again, thanks everybody for being on the webinar. Great discussion. We still have a ton of questions. We'll be able to get through those. We have an hour and a half panel discussion live next month in Atlanta with everybody. So thank you all the registrants for sending us these great questions, and we hope to see you in Atlanta next month. And thank you to the panelists. Until next time, this is the DSO Study Club, and we are Group Dentistry Now.